Hi, my name's Jeannie. I live in Montgomery, Texas. I am a cancer survivor. I've had 4 different types of cancer in my lifetime. The most recent was early stage breast cancer that was detected with an annual mammogram that I had at MD Anderson last year. I had surgery, and then due to the results of the testing on the tumor, it was suggested that I have a 6-month course of chemo to attempt to prevent it from returning within the next 5 to 10 years because the tumor itself was an aggressive type of cancer. I am just floored by this whole debate and the fact that it's even being thought to remove pre-existing conditions from our insurance coverage. I did actually, before the Affordable Care Act, I was in the Texas high risk pool. I paid almost as much for my health insurance at that time as I did for my house payment. Fortunately, I had the money to do it. I had the means to do it. My children were grown and they were off on their own and they were earning their own money. If they had been home with me, I would have just had to go without insurance because I couldn't have afforded it. And I probably would be dead by now because one of those cancers would have popped up. One of them was a melanoma, which is very unforgiving if you can't catch it extremely early. And fortunately, I live close to one of the best, if not the best, cancer centers in America at MD Anderson. But even living close, it's not within reach if you can't have insurance coverage or the financial means to pay for all your care. And if you put a block on pre-existing conditions, I don't know how many thousands and thousands of Texans will be left without health care coverage. As it is, there's too many that don't have coverage. And if it's just the checkbook that you're looking at, the economics of it, it's much less expensive if we allowed people to be covered by insurance and had them go to the doctor on a regular basis. Any disease, whether it's cancer or not, if it's caught early, then the treatment course is typically much less expensive, much less invasive than if you wait until it's at an advanced stage. And that can only happen if people are able to get to a doctor and to get tests done. And typically that only happens if they've got insurance that's going to cover those things. So I think if your bottom line is just financial, then you need to take another really hard look at it. And if it's not, then boy, I don't know where you're coming from. And Mr. Paxton, I don't know how you can sleep at night. Can you look me in the eye? Can you look little children in the eye that are battling cancer? I mean, these are tough kids, and they're battling cancer with a smile on their face. How do you look at them? How do you look at their parents? How do you look at anybody that's battling a pre-existing condition and tell them, no, you deserve to die because you don't have the money to pay for your coverage? Because that's the position you're putting thousands of us in. So I hope you really think about this.